The Zabrecky Institute of Biomedicine is kind of the culmination of what we've been attempting to do for the last 40 years. Our paradigm is a little bit different than standard medicine. So instead of symptom relief, it's to really reestablish health. That term is used so broadly that a lot of patients don't understand what they mean, but the term is really homeostasis. Homeostasis is at a happy place where your body's in harmony, it functions appropriately, you live your life in a kind of a joyful way, and you don't succumb to any major disease. There's still a lifespan. Okay, you can be in homeostasis, but you won't die before 85. If you're in homeostasis, the body can continue to function very well up to a maximum lifespan of 126. That's pretty well calculated. It's a couple years off, but the last time Yale did it about 10 years ago, called the Gompertz equation, it says 126 is the maximum lifespan. So life expectancy is much less than that, and many people, when they get to their life expectancy in their mid-70s, they'd like to do better if they could, particularly in our culture now. So we're looking for mechanisms that cause accelerated aging, and we try to restore them back to the normal protective levels. And you can do this through lifestyle change, the hardest thing to modify. You can do it through elimination of intoxicants. You can do it through taking proper nutrients to restore vital areas of the system. And you can do it by well visits, so the doctor knows what your status is and make the modifications that are necessary. Homeostasis, we'll talk about that for a second. This is controlled by your body. It's way out of the hands of any doctor. There are trillions of reactions that happen every second. In the heart disease, you want to do things that are going to increase the energetics in the heart muscle, because if you do that, the patient feels better and has more energy. So they do it with medications, but the medications provide a kind of an artificial forcing of the heart muscle, so it helps at the same time as it hurts, and ultimately the heart as a pump will fail. What you want to do is you want to increase the energetics that you have naturally, and there's products that'll do that. And in severe disease, you have to raise those levels very high in the beginning. And so rather than take them orally, you do it by an infusion. That speeds up the process. This developed as when I was very young, just out of chiropractic school. I ended up in Switzerland with some friends. I went there a week early. I was introduced to some doctors in Vevey, which is Switzerland. And they had a clinic, and the old German doctor who was sandbagging me because he only spoke German until he sat me down at his desk and he spoke English. He said that, and I must have been really young looking, I was like 27 years old. He said, so you think you're a doctor? And with all his years of experience, he made me feel like I was an idiot. But he said, I'm going to die pretty soon. And what I did was to treat diseases that you're not going to see. I treated diphtheria and syphilis and all these other diseases, which really aren't going to be a problem in the future. But you're going to have a problem with chronic disease. He says you're going to need to understand how to deal with chronic disease. And there's three things that he's seen, he's noticed over his many years in practice that I'm going to have to look for. And it was poisoning, infection, and malnutrition. He said those are still going to be the three major factors that produce aging, accelerated aging in the body. And that's held true. I've constantly looked for other ones. But when we pick a name of a disease like malignancy or cancer, diabetes, heart disease, dementias, they basically all start out as being a poisoning, infection, or malnutrition that went sour or neglected. You don't accelerate through your protective mechanisms unless there's some impediment that's really exhausting your body. So in patients that come in with chronic disorders, particularly the ones that failed standard of care, we gave them the drugs, didn't work. Or there is no standard of care. You've got a disease that we don't have a treatment for because not enough people have it to make it worthwhile for the drug companies to find you a medication. And we deal with those pharmaceutical companies. There's a couple of great ones out there. But they're stuck. They have no way for any level of recovery. And when we evaluate them, we're looking for environmental influences. Did they accumulate toxic metals? Did they accumulate toxic chemicals? They've been on the planet 30, 40, 50 years. The planet's pretty polluted. And it is true some people will still be okay. And I have patients in their 80s that have cholesterol over 450, no heart disease. So the genetics still plays a role in some categories, but it's not as much as they make it sound. But so we evaluate for toxic substances. We evaluate for residual hidden infections. I mean, Lyme certainly brought it to the forefront that you can have a chronic infection that'll slowly debilitate your life, but the organism is still there and they can't eradicate it. So chronic infections, I think, are important. When you look at someone's DNA, 33% of it's viral. So over many millennia, we've accumulated so many viral particles and dealt with them. And although that doesn't give you disease, we still see people coming in with shingles. You know, they caught chickenpox as a kid, and now they're ravaged with these neurological pains because their shingles came back because their immune system made a glitch. So these things are recognizable, they're important to understand. And after they get over the acute part of the illness with shingles, you want to go back and take a look at their immune system. So I think as far as reestablishing homeostasis or normalcy in the individual, what we're looking to do is measure for impediments, poisoning, infections, malnutrition, and just support the organism. Just give them what they need to get back to normal functioning. We're constantly pushed off the track. Okay, we can be pushed off the track from emotional issues. We can be pushed off the track because cold temperatures for too long. We can be pushed off the track because we're neglected medically. Physical traumas. So many things can distort you away from homeostasis, but the body tries to regain normalcy. You see a young person with pneumonia totally recover. You see an old person with pneumonia die in a week. Same disease, but the old person has no reserves left because they've used it all up on trivial things as they've gotten older. Now, it could be cigarettes, it could be alcohol, it could be a bad marriage. All these things kind of build up stresses in the body which make you go through your reserves. And it leads into a segue for what is our reserves. They're basically your stem cells in your bone marrow. And you're born with a certain amount. It doesn't change, but it goes down. And once you use up your reserves, you have nothing left. You can't expect to have any repair. So on the death certificates, now they put down complications of old age. Their liver didn't fail. They didn't have dementia. Their GI tract was okay, but they still died. So they had no reserves left. So trivial things from the environment just overwhelmed their body. So in a person that's in homeostasis with good reserves, the average age is 85, plus or minus 2 years. That's the average lifespan.